I'm going to share with you the most common cause of disc herniation, and also in my experience the best treatment options to help relieve this disc herniation pain. I'm Dr. Dave Adamson of Bonita Springs Chiropractic Back and Neck Clinic. The most common cause of disc herniation fall under one of two categories. One is major trauma, like getting in an automobile accident, and number two, minor trauma, bending over, picking something up, or turning your neck too quickly, causing the disc to herniate. Now let's talk about, I want to share with you a little bit about the injured anatomy that goes with the disc and the disc injury. There's actually two different categories. There's a bulge and then there's a herniation. The bulge is where the material on the inside of the disc starts to push out on the edge of the disc itself. A herniation is where that inside material actually goes outside of the area of that outer layer of the disc. So we actually have two different things that we're talking about. And it can also affect the nerve or the spinal nerve if that herniation pushes all the way out. If it's just a bulge, we might see a loss of height in the disc itself, which causes a lot of pain in the joints, in the segments between the disc itself. Typically, our patients will come into our office experiencing things like pain, muscle spasm, lack of mobility, maybe some numbness or tingling in their arms if they have a neck injury or a neck disc, or if it's in a low back. We'll typically see the patient having weakness in the legs or numbness or tingling shooting down the legs as well. So those are some of the symptoms that we typically would see when a patient comes in. Now let's talk a little bit about treatment options, or what we find to be the most effective treatment options for our patients with this disc herniations. Number one, chiropractic care. Chiropractic care is a manual therapy that really helps create motion in the areas that are lacking motion. And that motion helps heal the disc, helps the disc heal from the injury that it's sustained. Also, electrical stim. Electrical stim is a great modality when applied either in the low back or in your neck to help decrease the pain, the muscle spasm, and the lack of mobility. The disc can be very painful, so we definitely want to really control some of the pain that you have. Also, we do things called active rehabilitation or active therapies here in this office, because there's two things that we want to accomplish with that. Number one, permanency. We don't want this to be a permanent problem for you. We want best resolution for you as possible. And active therapy allows us to do that, to create motion and also stabilize those areas around the disc that's injured. Secondly, is we want to decrease your chance of re-injury or re-injuring the disc itself. So once we go through this process of helping you get better and helping the body heal, we want to stabilize and strengthen the areas that decrease the amount of possibility of re-injuring the area. In summary, these therapies really help with disc injuries in decreasing the symptoms that you have, such as decreasing the pain, decreasing muscle spasm, increasing your mobility, decreasing that numbness, tingling, or the lack of strength in your arms or in your legs, depending if it's in your neck or in your low back. Our patients typically report to us that they can return to work faster, or they can actually stay at work longer without the pain that they've been experiencing. They also tend to sleep better without that disc irritating the nerves or the joints and causing all that inflammation. They're able to sleep throughout the night very, very well. Also, they're able to bathe better. So if you have a disc herniation in your neck and you're trying to wash your hair, it's very difficult with that herniation. So if we reduce that and we help you with that, you're able to wash your hair. Or if you have to tie your shoes, you got a disc injury in your back, we really want to help you with that as well. So if you're really suffering from a disc injury or a disc herniation, I want you to give our office a call, 239-221-7123. We really look forward to helping you.